Okay, let's dive into something really quite remarkable today. We need to sort of rethink what we even mean by medicine, because this deep dive we've done suggests that something as basic, maybe even something you dread sometimes, like just moving your body,
Yeah.
it isn't just, good for you in a general sense. It's actually looking like a powerful medical intervention, potentially life-saving.
Yeah, specifically for a really serious disease like colon cancer. It really does challenge how we usually think about treatment, doesn't it?
It absolutely does. And we looked at a whole stack of information for this, some really compelling research papers, expert opinions from oncologists, researchers all over the world, actually.
And there was that patient story, too, which was just incredibly moving. What really jumped out is that physical activity for colon cancer survivors, it's way beyond just being a lifestyle choice.
Exactly. So our mission today really is to unpack this evidence. It feels pretty groundbreaking. We want you to understand why getting active after you've gone through treatment isn't just about, feeling a bit better. It's now being framed as a key part, maybe even a life-saving part of the actual treatment plan.
And, to really get why this is such a big deal, we need to just quickly set the scene. Colon cancer is still a massive global health issue.
Hmm.
It's, what, the third most common cancer diagnosed across the world?
That's right. And number two, tragically, when it comes to cancer-related deaths globally, the numbers are just staggering. If you look at the U.S., the forecast for 2025 is, well, it's grim.
Yeah.
Over 154,000 new cases expected and almost 53,000 deaths. That's a huge number of people, of families affected.
And the difficult truth is, even when treatment seems successful, the fight often isn't completely over.
Hmm.
For patients with stage 3 colon cancer, something like 30%, about a third, unfortunately see the disease come back after they finish chemo.
That fear of recurrence, it must just hang over people.
It does. And then there's this other really worrying trend. We're seeing more cases in people under 50.
Yeah, I saw that. What's the thinking there?
Well, the suspicion, and it's a strong one, is that it could be linked to our modern lifestyles. Maybe sitting too much, not moving enough, changes in diet, perhaps.
Right. Which makes understanding how lifestyle factors like exercise impact things even more critical.
Exactly. And that leads us right into the heart of our deep dive today. There's this one particular study that's genuinely changing the whole conversation.
This is the challenge study, right?
Yeah.
Also known as CO.21. And we should be really clear, this wasn't just like looking back at some data.
No, not at all. This was a proper, rigorous, randomized controlled trial, which is, the gold standard in medical research.
Mm.
It's designed specifically to figure out if the intervention, in this case, exercise, actually causes the effect.
Isolates that one factor.
Precisely. And the scale of it was pretty immense. It took 17 years from the initial idea to getting the results published.
Wow, 17 years.
Yeah, involved researchers in cancer centers across 6 different countries:
Hmm.
Australia, Canada, the UK, the US, Israel,
Hmm.
others too. A huge international effort.
So who was in the study?
They enrolled 889 patients, all of whom had finished their treatment for colon cancer. And here's a really important detail. Their average age was 68.
Okay.
And they were picked specifically because they weren't currently meeting the standard physical activity guidelines.
Ah, so this wasn't about proving super fit people do well. It was about seeing if exercise helps regular folks, average folks recovering from cancer.
Exactly that. It wasn't a study on athletes. It was about the potential benefit for typical patients.
And how did they set it up?
It was actually elegantly simple in its design, but powerful. They randomly split the patients into 2 groups.
Okay.
Group 1 got what you might call the standard care approach.
Yeah.
Basically some general health education materials,
Hmm.
like getting a pamphlet with some advice.
Right, the usual leaflet.
Usual leaflet, yeah. The other group, though, they were enrolled in a structured supervised exercise program that lasted for 3 years. And it was personalized.
3 years of a program, and they tracked them for longer than that, didn't they?
They did. That's crucial.
Yeah.
The follow-up went on for 8 years in total from when they entered the study. So 5 years after the 3-year exercise program finished,
Yeah.
that lets you see the real long-term impact.
On survival, on the cancer coming back.
Exactly. And the findings were so significant, they got published just very recently, June 1st, 2025, in the New England Journal of Medicine, which is, an up-tier medical journal.
Huge deal.
And at the same time, they presented the results at the big ASCO meeting, the American Society Clinical Oncology Annual Conference in Chicago.
Mm. Imagine thousands of cancer experts hearing this data for the first time.
The buzz must have been incredible. So, okay, this exercise prescription,
Yeah.
what did it actually involve? It wasn't like training for a marathon,
Crazy.
right?
Oh, definitely not. It was a 3-year program, yes, but the real focus was on making it doable and, importantly, personalized. Patients worked with fitness coaches.
These coaches helped them create exercise plans that suited their abilities, what they actually liked doing, and importantly, what felt safe after cancer treatment. Plus, regular check-ins to help keep them motivated and on track.
And the goal wasn't crazy high intensity.
No, the core target was actually pretty moderate, aiming for about 30 minutes of activity 5 times a week.
So 150 minutes a week, that's the standard guideline for general health, isn't it?
It is, exactly. And the types of activities they mentioned were so accessible. Things like brisk walking. Most people can do that right outside their door.
Sure.
Swimming, cycling, even things like salsa dancing. The key was flexibility and finding something the patient enjoyed, because that makes it sustainable, right?
Yeah.
Especially for people who've just been through something as tough as chemo.
Makes sense. Sustainability is key. Okay, let's get to the results then, because you said they were astonishing. After 8 years of follow-up, what did they find?
It's honestly hard to overstate it, the headline number. The group that did this structured exercise program had a 28% lower chance of their colon cancer coming back.
28% lower risk of recurrence. Wow. For patients living with that fear, that's enormous.
It really is. But then, and this is the part that's arguably even more stunning,
Go on.
that same exercise group had a 37% lower risk of dying from any cause during those 8 years.
Wait, not just from the cancer, from any...
From any cause. 37% lower all-cause mortality. Think about that. Exercise wasn't just potentially stopping the cancer returning. It was linked to people living longer overall. Better heart health, fewer other issues perhaps. It's profound.
That is incredible. Do we have more specific numbers, like year by year?
Yeah, they broke it down. At the 5-year point, 80% of the people in the exercise group were still cancer-free,
Okay.
compared to 74% in the control group, the ones who just got the pamphlet. So already a 6% difference there.
A clear gap emerging.
Definitely.
Yeah.
But then, by the full 8-year mark, the overall survival difference was even bigger. 90% of the exercise group were still alive.
90.
Versus 83% in the control group. That's a 7 percentage point difference in overall survival over 8 years. In cancer research terms, that is a massive improvement.
7% more people alive after 8 years. Let's put that in raw numbers. How many actual lives are we talking about?
Okay, so over the full 8 years, in the control group, the pamphlet group, 66 people died. In the exercise group, only 41 people died.
41 versus 66.
That's 25 fewer deaths in the exercise group. 25 people who likely got more years, better quality years maybe, because they incorporated regular moderate exercise into their recovery.
25 lives. That's incredibly tangible. And what about the cost? You hear about cancer drugs costing fortunes.
Right, and that's another striking point from the research we looked at. These supervised exercise programs, they cost something like a few $1,000s per patient, spread over 3 years.
A few thousand total.
Yeah, and the researchers themselves pointed this out compared to cancer drugs that can easily cost hundreds of thousands of dollars per patient per year sometimes. They called the cost of the exercise program peanuts.
It's a remarkably effective intervention for a comparatively tiny cost.
High impact, low cost. You don't often hear that in healthcare. Were there any downsides? Any risks?
Well, nothing major, but they did report it honestly. The exercise group had a slightly higher rate of minor muscle strains, maybe some aches and pains, minor injuries.
Which kind of makes sense if you're getting more active, especially after treatment.
Exactly. It's understandable. But when you weigh those minor issues against a 28% lower chance of cancer recurrence and a 37% lower risk of dying.
Yeah, the benefits clearly massively outweigh those small risks.
Absolutely.
So the huge question now is why? Why does exercise have this incredible effect? What's actually happening inside the body?
That is the million-dollar question, isn't it? And it's exactly what researchers are digging into right now. It's like the deep dive within our deep dive.
Right.
You know, exercise does a lot of things systemically throughout the body. They're looking at a few main possibilities.
Okay, like what? One big area is metabolism, especially how the body handles insulin. There's quite a bit of evidence suggesting exercise improves insulin sensitivity.
And bad insulin function is linked to cancer.
Yeah, sort of dysregulated insulin pathways seem to play a role in how some cancers grow and maybe come back. So the idea is by improving how your body processes insulin, exercise might be making the environment less friendly for any remaining cancer cells.
Interesting. Okay, what else?
The immune system, that's another major focus. We know exercise can kind of tweak immune function.
How so?
Well, the thinking is that regular moderate activity might boost the body's own surveillance system, making your immune cells better at finding and destroying any tiny clusters of cancer cells that might have survived chemo and could cause a recurrence later on.
Like putting the immune system on higher alert in a good way?
Sort of, yeah, enhancing its effectiveness. And this is cutting-edge stuff. The researchers were smart. They collected blood samples from the participants throughout the study.
Ah, so they can analyze those now.
Exactly. They're looking at the molecular level.
Yeah.
Are certain markers for inflammation changing? Are specific types of immune cells becoming more active or effective? They're trying to pinpoint the actual biological pathways being changed by the exercise.
Fascinating. Peeling back the layers of the why.
Mm-hmm. But it's not just about the numbers and the biology. It's about the people. We came across the story of Terri Collins. She's 62, from Kingston, Ontario, and she was actually in the exercise group in the challenge study.
Oh, wow. Her story must really bring this to life.
It really does. She chose walking as her main activity, aimed for about 45 minutes several times a week. And she wasn't just told, go walk. She had support from her physiotherapist, Allison McDonald, who helped tailor it for her.
That support sounds key.
Terri said it was. And her motivation. She said she wanted to feel like she was doing something for herself, taking some control back after everything she'd been through with treatment.
I can understand that.
And she also mentioned accountability. Knowing she had those check-ins with her coach helped her get out the door, even on days when maybe she didn't feel like it.
We all need that sometimes. And how is she doing now?
It's incredibly inspiring. 3 years after the program finished, she's still walking regularly, she feels fit, and most importantly, she's still cancer-free.
That's wonderful. A real testament to the impact.
Absolutely. And you hear that sense of conviction from the lead researchers, too. Professor Jeanette Vardy, one of the international co-chairs of the study, she said quite directly, our findings will change the way we treat colon cancer.
That's a bold statement.
It is. But she clearly feels the evidence is that strong now. She envisions these kinds of structured exercise programs becoming a standard part of care, right alongside chemo and surgery.
Wow. A paradigm shift.
Pretty much. And Professor Kerry Cornea, another big name in this field of exercise oncology, he made a similar point. He said exercise is no longer just a quality of life component.
Right, not just about feeling better.
Yep. Exactly. He says it's a treatment that should be available to all colon cancer patients. That change in perspective from exercise being nice to have to being actual therapy. That's huge.
It really is. Now, someone listening might be thinking, okay, that's great for colon cancer survivors, but what's the takeaway for me? How does this deep dive connect more broadly?
That's a great question, and I think it connects in several really important ways.
Yeah.
Firstly, prevention. If regular, moderate exercise makes such a difference after someone's had cancer and chemo, just imagine what it could be doing for prevention in the first place.
Especially with those rising rates in younger people we mentioned.
Exactly. It makes the case for staying active as a potential way to reduce your risk even more compelling for everyone, really.
And you mentioned the cost earlier. That has broader implications too, right?
Absolutely. That contrast between the huge cost of many new cancer drugs and the, well, peanut cost of these effective exercise programs, it points towards a potentially more sustainable way to improve outcomes in healthcare.
Integrating exercise as a prescribed therapy could actually save healthcare systems money in the long run, perhaps.
It certainly could. It really strengthens this whole idea of exercise as medicine. Not just a vague suggestion to be more active.
But like a specific prescription.
Yeah.
Maybe even supported by health services, with coaches, tailored plans, like any other medical treatment.
That's the direction this seems to be heading. And the researchers, they aren't just publishing and moving on, they're actively pushing for change.
What are they doing?
They're advocating now, talking to policymakers, health authorities around the world, trying to get these findings integrated into official clinical guidelines.
So it becomes standard practice.
That's the goal. And Professor Hariana Dillon, she helped design the actual exercise part of the study. She emphasized again how crucial it was that the plans were designed to be sustainable and enjoyable.
Because people have to stick with it.
Right. Finding something you actually like doing, that you can keep doing consistently, that's way more effective than some brutal workout plan you'll quit after a week.
Makes total sense. And what are other experts saying? Is this likely to change guidelines soon?
It seems very likely. We saw comments from people like Dr. Ravi Mehrotra, who has connections to global health bodies. He thinks these findings really could transform cancer care
It's
globally.
like transform it.
Yeah, because while doctors have always kind of encouraged exercise, having this level of high-quality randomized trial evidence specifically showing a survival benefit after diagnosis, that's new, that's powerful.
So we could genuinely see oncologists writing prescriptions for exercise soon.
It sounds like, imagine getting a script that says, brisk walk 30 minutes, 5 times weekly, right next to your other medications. That future feels much closer now because of this study.
Incredible.
Yeah,
So wrapping this up, the call to action here seems pretty clear, doesn't it?
it does. If you're listening and you feel inspired by this, whether you or someone you care about is a cancer survivor, or even if you're just thinking about your own health,
Yeah.
the message is get moving.
And it doesn't have to be overwhelming. Remember Tara Swain Collins' story?
Exactly. Start small. Find an activity you actually enjoy. Could be walking, could be dancing in your living room, gardening, cycling, whatever works for you. The absolute key, underlined by this research, is consistency. Doing it regularly. That's what made the difference.
So this deep dive really leaves us with a powerful thought, doesn't it? Something to maybe walk with rather than just sit with.
Swim. Yeah.
Exercise is moving so far beyond just being a healthy habit.
Yeah.
It is seriously emerging as a form of potent medicine, and it's incredibly affordable. It's accessible to most people, and it has these profound life-changing impacts on survival, on well-being. So the question to ponder is, what does it really mean? For our health systems, for how we think about preventing disease, and maybe for our own power, our own agency in managing our health. What does it mean when simple, consistent movement becomes recognized as a powerful, prescribable treatment?
It's a big question, and hopefully one that inspires action.